One day in the future, perhaps you will witness a person suffering and collapsing right in front of you. If it happens, do you know how to save the person? Now, we will explain the actions and how to save lives. First, check that the area is safe, then approach the person. Then tap the person's both shoulders and ask him, her, "Are you okay?" to check for reactions. If there is no purposeful gesture, such as opening the eyes or responding to the call, you can judge the person is unresponsive. Call for help and ask people around you to call 119 and bring an AED if it's nearby. Next, check to see if the person is breathing. Look at the chest and abdomens rising and determine within 10 seconds whether the breathing is normal. If you judge it's unnormal, or if you cannot judge, perform chest compressions. For chest compressions, put your hands together like this and compress the center of the chest. Keep your elbows straight. You should push the chest vertically about 2 inches deep. You should perform chest compressions at a rate of 100 to 120 times per minute. Release pressure enough between compressions for the person's chest to return to its original height. After performing 30 chest compressions, give artificial respiration. If you hesitate to give artificial respiration, keep doing only chest compressions. To perform artificial respiration, first do the airway management. Place one hand on the person's forehead and place the index and middle fingers of your other hand on his/her chin. Then, tilt the person's head back and lift their chin up a little. Next, open your mouth wide and cover the person's mouth. Blow in about 1 second to make the person's chest rise. Release your mouth and blow again in the same way. Repeat the cycle of 30 chest compressions and 2 artificial respirations until the person starts breathing or the emergency services arrive. If an AED arrives, turn on the power and follow audio instructions. Following the illustrations on included electrode pads, attach them directly to the chest of the person. Once you attach the pads, the AED will tell you to keep away from the person's body. Make sure no one touches the person's body. The AED automatically determines whether an electric shock is necessary. If the AED determines that an electric shock is necessary, it will say that an electric shock is required. When charging is complete, it will tell you to press the shock button. Make sure no one is touching the person and press the shock button. Immediately after an electric shock, repeat chest compressions and artificial respiration. Repeat the cycle of chest compressions, artificial respiration, and the use of AED until emergency services arrive and take over the rescue.